Hello, I'm Dr. Athul. I'm a neurologist from Kerala, and I work in Mediterranean Hospital in Kerala. I passed my D.N. Neurology from seizure Institute of Medical Science in Trivandrum. So, my topic for today is seizure and epilepsy. What is a seizure? What is an epilepsy? And how to recognize an epilepsy. So basically, seizure is a condition which results from abnormal activation of the brain and finally leads on to something called as a convulsions usually. So, what is a convulsion is that what we usually see externally, that it is a violent movement of the upper or lower limbs, with the both hands and both legs, with uploading of eyeballs, the patient being very agitated. So this kind of a situation lasting for a few seconds or 2 minutes, and following the patient becoming unconscious. This is what we usually mean by telling convulsions, and the medical term used is a seizure. So how does a seizure occur? The seizure actually it can have several causes. So it can be a symptomatic seizure. Symptomatic means it can occur as part of a secondary disease. Like suppose if you have an infection in the brain, you can have seizure as one of the manifestations or one of the symptoms. Suppose if you have some metabolic abnormalities like low or high sugars or sodium, low sodium, or some other conditions like a poisoning. So a tumor or any other structural issues like even if in the case of a stroke. So all these situations can lead on to seizures. So seizure is nothing but it is the final result of some sort of an irritation in the brain. So it can have several causes as I mentioned. So next is what is an epilepsy. So epilepsy is a situation where you get recurrent seizures. And in fact, all these seizures should be unprovoked. So there shouldn't be any apparent cause. And the patient getting recurrent seizures 24 hours apart. That is, the patient can have one seizure today, and he can have the second seizure maybe 7 days later, or 1 month later, or 3 or 5 months later. So this is actually what is epilepsy. So epilepsy is also so basically epilepsy is a tendency to have recurrent seizures. So depending on the age group, so the epilepsy can have several causes. So the causes may be a different set in a child less than 10 years. So it can be of a different nature if the age group is between 10 to 20 years. So depending on the age group, the cause of the epilepsy differs. So basically, what we have to understand is all epilepsies. So basically, seizure is epilepsy. Epilepsy is a tendency to have recurrent seizures. So it for a person to recognize what seizures are, if it is convulsive, like I mentioned before, where the patient is very apparently agitated and eyes being the uploading of eyeballs, with the patient not responding, he may or may not have tongue biting or frothing from mouth. So all these situations could be easily recognized as seizures. But something which the public has to know is this situation is not just seizures. Okay. So what else can be seizures? So seizures can be a non-convulsive seizures also. So suppose if a patient he remains stable. I mean apparently he is not agitated, but he has lost contact with the environment or the surroundings, and he is not responding or he is inappropriately responding. And he may have some chewing movements or some lip biting or some unwanted movements of his limbs. So lasting for a few seconds to minutes, where the patient has lost his response. As for the sense that he has not fallen down, he has not lost his full consciousness, but still he has lost connection with the environment. This also is seizures. So the people have to be aware about this kind of presentation of seizures, which is a non-convulsive seizures, which is difficult to recognize. The people may not understand this as seizures, or they may not perceive this as seizures. So these are also seizures. So basically, once these are recognized and this happens one after the other recurrently, you keep in mind that this particular patient may be suffering from an epilepsy. So once you encounter such a situation, you'll have to meet a neurologist and to seek treatment, to seek what the cause is. So the final outcome of the seizures depends on what type of seizures, as I've already mentioned. Different age groups have different causes, and different causes have different outcomes. Some may require, or some may get controlled with minimum drugs. So some may require many drugs, and finally, some cases may also end up in having epilepsy surgeries also. So all this depends on what kind of seizures the patient has, and this has to be evaluated and informed to you by a neurologist. Thank you.